Okay, welcome everyone. I am Simon Workman with Prenatal-to-Five Fiscal Strategies. Great to have so many of you with us today. I know there's a lot of competing webinars going today and lots of different things for your priorities. So we appreciate you joining us, and we are going to be recording this webinar as we always do. If you have any colleagues that are not able to join us today. This is part 5 in our webinar series. And as we always do, just a grounding of where we are. We've covered a lot of ground so far around introducing the concept of comprehensive fiscal strategies, talking a lot about fiscal strategies in terms of mapping and modeling and revenue generation. Last time we talked about governance and shared leadership. And while there has been a focus on equity across all of our webinars, and we've tried to make sure that we're being intentional about thinking about equity and how that your investment strategy really needs to think about advancing equity. Today, we're going to dig a lot deeper into that, focused on investments and the implementation of your fiscal strategies and how you can use those to advance equity. A reminder, if you missed any of the other parts of this series or want to review them again or share them with colleagues, they can be found on our website, prenatal5fiscal.org/webinar series. So we're very excited today for our discussion today to have some great speakers joining us. So you'll hear a little less from Gina and I today and more from our great speakers, which is always a good aim. We're joined by Ngozi Lawal from the Center for the Study of Social Policy, and she's going to talk to us about equity-driven community strategies. And then we have some great partners from King County, Washington, who are going to share their experience with making equity-driven investments. But before we get into that, as we always do, just want to kind of ground us all in our comprehensive approach, because this is even more important when we start talking about equity. The importance of all of the systems change that we have talked about, all of the systemic change that we want requires this comprehensive approach. So if you're a reminder of our graphic that we've shown a number of times, we've spent a lot of time on the frame looking at the cogs on the left-hand side of the screen, which I know is just catching up with us with the left-hand side of the screen when it comes up. We spent a lot of time looking at those cogs and looking at equity through that lens. But we're really digging down deeper today, because when you look at that purple box at the end, your vision for your P-5 system, and when you start looking at a system that actually works for all families, providers, businesses, and caregivers, and really is trying to get to that vision, there is no way to get to that vision without centering equity, right? Without aligning both your vision and your principles and all the strategies you do in service of that with that intentional focus on equity. And to that point, as we think about the principles, and a reminder, we always put these principles up at the beginning of our webinars, our key 6 principles that underline this work. Obviously, number 4 on this list that's in bold here is very explicitly about equity and explicitly about remediating the inequities in the system and taking intentional steps to do that. As we've talked about a number of times, all of these principles have equity considerations, especially when you look at things like a system that works for all children, a system that's fair to providers and pays them adequate compensation. There is a clear equity implication, an equity component to achieving those principles. So it really is something that cannot just be an add-on. It needs to be a key part of your analysis and your considerations throughout the whole of this work. And so to that point, we just want to do a very quick poll to get us started, just to kind of see where you all are in terms of your use of equity strategies. So Casey or Gina is going to launch a poll right now that you should see pop up on your screen. If you don't have access to that, not all browsers allow polls, I'll read out the question and feel free to answer it in the chat. So we're just looking for which activity are you furthest along in applying an equity lens. So if you're doing any equity work and applying an equity lens to your work, where are you making the most progress on that? So is that in investment decisions, funding administration, funding impact, disaggregating data on funded services, or none of those above? Maybe you're focusing on equity in other parts of your system, but just to help ground us in where we are. And it's completely anonymous, so if none of the above is the real answer, be honest, because that's part about understanding the work that needs to be done in this space?
So we have a pretty even mix, actually. The highest is none of the above so far. So if there's an area where if it's just none of the above because it's not hasn't been intentional yet in how you think about your fiscal strategies, then certainly, again, we understand that. But also if there's another area and you want to put that in the chat, don't hesitate to fill that in with your colleagues. But we have a couple folks that have felt that they're furthest along in applying the equity lens to their investment decisions, as well as the impact of funding. Those are sort of the two that are getting the most hits outside of none of the above right now. And we're about 62% folks have filled it in. So I'm going to give it one more second and then close the poll, and you'll get to see the results too. We really want to always be continuing to push that we're all reflecting on where we actually are in these concepts. And so that's one of the reasons why we put this poll out as a first idea of reflection on where would you really actively say that you are in the work. And then we also want to, through the strategies and the tools and continuing to bring speakers who have gotten deeply into this work to the webinar series, to then really get into the work of what the activities are. So we're not just sort of talking about how important something like equity is, but we're actually working on strategies and thinking about how to build new strategies to do the work. So you should see the poll results here. So we still ended up with the none of the above as the biggest winner. And the next is folks working on thinking about, from an equity lens, the impact of funding and investment strategies.
And interesting to see funding administration very low on there. I mean, not surprising, you know, but one of the things we talked about in the last webinar, and if you weren't able to join the last webinar, I encourage you to take back and look at that, you know, is when you think about the governance of your funding, the leadership of your funding streams, you know, putting the equity lens to that as well is obviously really important. Okay, and with that, Gina's going to lead us through some more content and introduce our speakers.
So along the lines of really starting to unpack and think about work, I wanted to share we're going to share a tool in the chat as well that, as Simon said, the principles really embed equity throughout our conversation and our work with states and communities. And how I know many of you work on this issue is to really be thinking about it in all elements of the conversations that you're having. But we also know that there are some particular angles and focus to ensure that, again, it is not just a conversation point, but it actually is getting into action that can be really useful to support all of us. So while there's a lot of really great equity tools out there, the one that we're sharing today is actually from the Build initiative because of the fact that it brings a systems lens. And so in the tool that will be populated in the chat shortly, we really want to think about how, if we think about that comprehensive approach and moving towards policy and practice change that supports your full vision for your prenatal-to-five system, we know that systems change has to be part of that. And some of it is really hard and deep systems change, and system change in particular around how funding is utilized, how it's administered to programs. Those things are really some of the biggest sea changes in how systems function. And so of that equity levels of change that are shared in the Build tool, there are 4 areas, inter and intrapersonal being the other 2 that I've not highlighted up today. What I've highlighted up is the programmatic or institutional level of change and the systemic or structural, because I think when we really think about how, when you're working under a set of principles like those that we share through the P-5 approach, when you're really then digging in on action related to those, the biggest areas of change that are probably going to be the hardest across a group of players coming together, trying to work collaboratively, are going to be those programmatic or institutional changes and the systemic or structural. But those are also probably going to be the most important, because we know that we can sit around together and be in a shared mindset around how important our role is in equity and our role is on making changes to inequitable situations. But the reality is, if we don't change the systems that we function within, the inequities are going to continue. They're going to be embedded and continue on. And so we share is just a highlight of a few things from that tool that really hopefully give a little bit more sense of what some of the action would be. Some of this is still at that stage of sort of reflecting on, am I applying a racial equity lens to the opportunity opportunities and how I advance workforce within my organization. So it's not telling you exactly how to do that, but it's asking the question if you are, but there's some more processing questions within that particular framework or tool that allow for even going deeper into the work and then moving to that work of saying, what are the responding activities or strategies that we need to take to begin making more of this change? So we share this as an additional frame and resource as you're reflecting on where you are in the work as well, and how you really embed it within your system change and your fiscal strategies, systems change. So with that, I'm going to turn us to our speakers. We are, as Simon mentioned, really excited by our speaker pool this afternoon or morning, depending on where you are in the country. We're starting with Ngozi Lawal from the Center for the Study of Social Policy. And Ngozi is a colleague that works closely with Pritzker-funded communities and states. So I know many of you know Ngozi's face and work well. We had seen and are thrilled that Ngozi is going to share some of the background behind a brief on community-driven community investment strategies and really speak to us more about how they actually have equity at some of their heart and core, and even if they didn't necessarily start with only that lens to their work. So I'm going to turn it to Ngozi at this point to tell us a little bit more about how this has been approached at some of the different communities across the country.
Great, thanks, Gina. Can you hear me? Just want to make sure my sound is good. Well, it's really exciting to be with you all here. As Gina pointed out, I'm Ngozi Lawal, and I'm at the Center for the Study of Social Policy, and I work with Gina and many others on the Pritzker Children's Initiative and providing support through the Hub Technical Assistance to communities and states. And I'm excited to talk a little bit about what we've learned about equity-driven community strategies. Last spring, my colleagues Erin Robinson and Grace Reef issued a report, and just for full disclosure, that the report is due for a refresh because some communities have had some exciting updates, but it's still valuable, and so that's why we're sharing it today. The report highlights 6 communities that have either secured early childhood financing or have come really, really close to it. Just for the time constraints that we have today, I'll just be talking about 2 communities. But in the report, if you have a chance to look at it, so this is the cover slide of it, and we can make it available to you after today's discussion. You'll see that more and more communities are in fact coming up with new creative solutions to fund early childhood services. And they're doing it with very strapped budgets. So I hope this is encouraging to you that this work is possible. And what we're learning is that sometimes the money is coming from savings that are realized from current budgets, and other times we're seeing that the money is coming from the pursuit of a local tax option to come up with a brand new funding source. So the strategies are pushed through different vehicles. You'll see that some are being pushed through a ballot initiative where you go directly to the taxpayers and ask, do you want this thing? And then other initiatives have been pushed through legislation. So maybe it's the city council or the county commission that passes some policy that creates language for funding, and in some cases actually attaches funding to it. So those are sort of the differences that you'll see. But what's similar about all of the examples that are provided in the report is that they're all tied to an equity issue. So if you go to the next slide, Simon, then we can start talking about the 2 examples. I'm just going to move my screen here so that I'm not looking up and looking like I'm not paying attention to you. Okay, great. So in these 2 examples, we have Kent County, Michigan and Mecklenburg County, North Carolina, 2 very different communities. I'll just start with Kent County and starting with the inequity or the problem that they're trying to solve. So Kent County had been really good about conducting these occasional gap analyses to see how their children are doing. And what they learned was that children were starting school, starting kindergarten, not ready. And so they saw this gap analysis over gap analysis and gap analysis again. And so what they were looking to do was to raise some dollars that would be able to solve some of the problems that they saw. They did this through a property tax millage that they called it. So I'll just refer to it as the millage from here on out. And so that was a ballot initiative that was decided by voters. And then in Kent County's case, the ballot initiative had to be put on the ballot by the county commission. So every community has their own unique rules about how something gets passed. And so in this case, it was the community being able to convince the county commission structure to put this on the ballot and for voters to vote on. And so that's what happened here. In this proposal, it was an increase of 25 cents for every $1,000 on taxable value. So that's, you know, a home, for example. The example that you see here, if you had a home, the value of $300,000, the annual tax to the taxpayer would be $37.50. Not bad. So that's the argument that the community made about the amount, or the amount that would be required to create change. In the end, it got passed in 2018, and they were looking to create $34 million over 6 years. And they're about halfway-ish through their this millage. So they've spent about 3 years working on the services that you see on the right. So, you know, providing developmental screening, and not just the screening, but the actual referrals and connection to services, a focus on children's health, improving quality in the early care and education space. And, you know, one of the things I really, really like about their millage initiative is the navigation services, which works to connect families to the services that they need. A theme that I see and my colleagues see as we talk about what is it that communities need or that states need is that sometimes there are services, but families don't always get to them. So this navigation service is really wonderful in the sense that there is a mechanism by which a family in need of some service actually gets walked, in theory, to the front door. You know, they aren't just given a number, they are actually connected. So that's what Kent County accomplished, and they're currently in the process of trying to make a case again to the policymakers that this is a good idea to put on, to vote on again for the next round of funding. So that's Kent County. I'll talk a little bit about Mecklenburg County, North Carolina. And the problem they were trying to solve was that they didn't like how they were ranked. So from Harvard study that looked at, you know, the largest cities in the United States, and Charlotte, which is a city in Mecklenburg County, North Carolina, ranked 50 out of 50. And that's not because they were the top of the class, but because they're the bottom of the class. And they were not very happy about that. But the ranking was particularly on the measure of intergenerational economic mobility, which is a really fancy way of saying, you know, if you're born poor, you're more than likely to stay poor, regardless of all of the different structures of society and help and things that one could, in theory, take advantage of. But the reality was that you're more than likely to remain poor if you were born that way. And so that troubled a lot of people and caused them to think about, well, what are the paths to move out of poverty? And so early care and education was one of the top priorities that was studied. So with that, the Board of County Commissioners decided to pursue a property tax, and that's what they did. They raised the property tax by 3/4 of a penny. So you can see the math there. In the first year, that raised $9 million. And then in addition, the county commission allocated $6 million. So that's a total of $15 million for that first year to fund areas like high quality childcare, and not just the provision of it, but access to it. One of the things that they found was that there was a huge waiting list for childcare. So in the right column, you'll see that in the second year, which is fiscal year 2020, when the county commission allocated an increase of 21 million, 14 million of the 21 million, so that's like 66%, was set aside specifically for eliminating the child care wait list. So that has huge implications for infants and toddlers, as you know. And I thought, this is a case that's, different from the first example that was presented, in the sense that this did not have to go to the voters. This was decided by the county commissioner. So this goes back to my first point of, it's really important to know what kinds of, what your decision tree looks like in your community. So I'll stop there, and I'm just with making the note, or just underlining here, that it's great to do financing work, but you have to be really clear about the problem or the inequity or inequities that you are trying to solve. And I think I'd be remiss if I didn't say that even though these were the inequities that were shown, we all know through our work that families of color are disproportionately affected by poverty, school readiness outcomes. And so this is an equity issue that we should be tackling when we're thinking about racial equity, in the sense that if we work on these issues with an equity mindset, we are helping to lift more children and families of color out of poverty and more in the opportunity zone. So I'll stop there. Thank you, Gina, and thank you, Simon.
Thank you, Ngozi. We really appreciate it. And it just highlights how much is going on at local community levels and how different what goes on at local community levels are. The link to the report is in the chat right now, and Ngozi is with us for the rest of the webinar. So if you have additional questions, that we know that learning about individual community examples, there's so much to unpack. So if you have any questions and want to learn more, you can put some questions in the chat. Don't hesitate to dig a little bit deeper on some of this work. Shows the power of our local communities. And I think that's what we're going to hear next as we move to really unpacking a given example. So we are joined by three speakers that are related to a particular equity-driven investment initiative in King County, which is where Seattle, Washington is located. I'm very particularly excited. We do, I think, a lot, and we talk a lot about childcare, and I have a heart of all things prenatal to five. So childcare is in there too. But I think that there are times that we don't always think about family support and home visiting initiatives, and how those are, one, facing some of the very same challenges as childcare, and two, trying to also address how funding is equitable in its nature and how it reaches the children and families that we're actually really need to be targeting to serve. And so this is an example from the home visiting space that we're going to dig more deeply in and unpack how they approach this. And I think some of what we're going to learn, starting with Melanie Maltry from Best Start for Kids, is sort of that it's a real long game to the investment strategy. And then we're going to be joined by Pam Williams, who is the state director for Parent Child Plus for the state of Washington, who works for Start Early. And then Sarah Walzer, the CEO for the National Parent Child Plus organization, is going to round us out with some reflections on their work of doing investing in home visiting across many of the states and communities, and how not having an equity-driven investment approach, what the challenges that we run into, and how bad it can be for children and families when we're not, and for the programs trying to serve them. So with that, I'm going to introduce and invite Melanie to take over and start us off.
Hi there. Are you able to hear me okay?
Mm-hmm.
Super. Okay. Hi. Well, I'm so grateful to be here talking with you. Again, my name is Melanie. I'm with Best Starts for Kids. And we're going to chat about home-based services, which is a term we use that's a little bit broader than home visiting. And I'll start by providing an overview of Best Starts for Kids at a really high level, which is on the next slide. Super, thank you. So Best Starts for Kids is a levy-funded initiative in King County, Washington, home to Seattle, Washington. And it's a 6-year levy, and it's about a $500 million levy over that 6-year period. And the purpose of Best Starts for Kids is to ensure that all families and kids in King County are happy, healthy, safe, and thriving. And so we do that through a continuum of investment areas, as you can see here. The first is in a set of Prenatal-to-Five investments. That's about 50% of our investments each year. And there's quite a number of services that are folded in there, and I'll just share them because this is a group that cares about early childhood. So we fund home-based services, community-based parenting supports, early basic needs, developmental screening and developmental promotion, parent-child health, infant early childhood mental health, childcare health consultation, expanded early intervention, and also early childhood workforce support. So there's quite a lot that's rolled into there. About 35% of our investments go to what we call sustaining the gain. So those are services from the ages of 5 to 24. We also fund a program area called Healthy Communities because we know families are successful and thrive within the context of community. And finally, about 5% of our investments go to data and evaluation. I think what's really important for the equity conversation is that while some of our funds, a small amount of our funds, are used to expand in-house service delivery, primarily in public health, that the great majority of our work is done through partnership with community-based organizations. So we partner with 281 community partners in our county to deliver 483 programs. And as I said, it's a $500 million initiative. And at this point, we've spent about $387 million. So one more year of investment before we go up for levy renewal. So all of our work is guided by the Children and Youth Advisory Board and is deeply rooted in a foundation of equity. So the 3 bullets you'll see here, these were 3 of many more developed statements on equity that were developed by our advisory board. I'm just highlighting 3 here, that equity is an ardent journey toward well-being as defined by the effective, that equity is disruptive and uncomfortable and not voluntary, and that equity is fundamental to the community we want to build in King County, Washington. So in Best Starts for Kids, we lead with racial equity, but of course are really careful to always attend to its many intersections of class and gender identity and sexual orientation and ability, etc. So while this is our very high level frame, as we go through the presentation, we'll get into the details of really how we've implemented equity at the systems level in practice. Part of that is understanding who we are in King County. A little known fact is that King County, Washington is actually home to one of the most diverse zip codes in the nation, 98118. People infrequently think of King County in that way, but I think it's important to know in terms of how it is that we do our work. 1 in 5 residents in King County were born outside of the United States in 2000. 15% of our residents were born outside, and this has grown to 23%. There are 170 different languages spoken in our county, and 50% of that growth since 2000 in King County is from Africa, Asia, Eastern Europe, and Latin America. Also helpful to know is that Washington is the 8th highest refugee resettlement state in the US, and we have the 3rd highest Somali population in the United States. Also important to talk about, of course, as we talk about our work, is what some of the disparities are in King County. So on the left side of this slide, you'll see some very significant racial disparities in maternal child health data in our county. This actually comes from the King County's Racial Disparities Dashboard. This is certainly not comprehensive, but just a few highlights are that Latinx communities were 1.2 times more likely to receive no or late prenatal care than the King County average. American Indian, Alaska Native Indigenous, and Black African American infants had an infant mortality rate at least twice as high as the King County average, and that Black and African American infants are 1.4 times more likely to have low birth weight than the King County average. Because Best Starts for Kids also really takes a strengths-based approach, We think it's really important to understand this data in the context of community strengths. The data on the right side comes from our Best Starts for Kids Healthy Youth and Early Childhood Survey. And some key findings from that are that American Indian, Alaska Native, Indigenous families reported the highest rates of emotional support compared to other King County families. Communities of color reported high rates of storytelling, singing to their children every day, with the highest number being reported among American Indian, Alaska Native. And that Latinx communities actually have some of King County's highest breastfeeding rates at 6 months. And I love this quote at the bottom. This came from one of our Black African American community cafes. And it says that culturally, we would like to say that we're doing well. We're overcomers. It doesn't matter how hard things are, we are doing well. And I think that's a really vital foundation to talking about race and ethnicity in a strengths-based approach, and not just from a deficit or a disparities-based approach, which we so often do. Great. So getting into the nuts and bolts a little bit, I wanted to provide an overview of our home-based services strategy. And this includes 3 different primary investments. And we were really thoughtful about these investments. There is a long history of very important work in our state done around evidence-based home visiting. As defined by the MICV Home Visiting Evidence of Effectiveness Review. And we wanted to think a little bit more holistically and broadly about how we did funding in our county. And so we invested in evidence-based and evidence-informed programs as defined. We also expanded that definition a little bit. We funded a bucket of what we call community designed programs in Best Starts for Kids. And then very importantly, and the subject of today's conversation, we partnered with the City of Seattle and with the United Way of King County in order to sustain existing investments in Parent Child Plus program in our county, and also to do a really significant expansion of those programs. And that's really important to think about, because in the first 2 buckets, Best Starts for Kids, we're able to sort of make a lot of the decisions on our own, always in partnership with community and providers. But in the other arrangement that we have through our partnership with City of Seattle and United Way, we have a much more collaborative approach, which is important for some of the work we did together. And finally, I'll talk more about this in a bit, but we also made a very significant investment in capacity building supports to support all of our programs. Next slide. Yeah. So there were really 3 high-level approaches that we took to our funding. The first one is that we prioritized funding small, culturally based community organizations. The second is that we acknowledged, as part of this, we acknowledged that there's been a historical underinvestment in BIPOC-led organizations, and that this historical underinvestment has really impacted their ability to build infrastructure and sustainability. And the third piece of this is that in order to address both of those, we made a really significant investment in providing culturally responsive and equity-informed capacity building supports. And I think this piece is worth unpacking just a little bit. So I'll share that in King County, and I imagine in many other counties, we've got a lot of nonprofit organizations that are operating, but as a government, we have historically primarily invested really only in the larger mainstream white organizations. And that for us in BSK, our priority was really moving toward small, culturally based organizations that are BIPOC led. And that this really requires a shifting from a selection perspective, from away from sort of looking at really traditional capacity indicators to capacity indicators that are focused on community relationship and community embeddedness. And that was a really big shift to make at the county, who has not historically done funding in that way. Great. So on this next slide, Pam and I are going to tag team this a little bit, and that's because we worked really closely on this body of work together. So I'll sort of talk a little bit about what we did at a high level, and then we'll get into some of the more granular pieces. But when we thought about taking those 3 priorities that I just outlined and really integrating them at the practice level, here are some of the things that we did. This first set is really focused on the requests for proposals and the selection process. So in advance of proposals being due, Best Starts for Kids provided free technical assistance to all applicants who wanted it to support application submission. What we know is that for many of our small providers, they often don't have grant writing capacity. In many circumstances, English may not be the first language of those who may be composing the grants, and that we wanted to support increased accessibility for all of those organizations by providing TA to really support the proposal development process. I see there are some people on the phone who actually supported that work itself, so that's really cool to have you here. As I said before, we really prioritize selecting small organizations that are embedded in community. And that means writing your RFP really differently, right? And it also means developing your RFP review process in a different way. And so again, we really shifted sort of what we're evaluating from these traditional capacity indicators, like, do you have really strong fiscal operations, right? To what are your relationships with community? And those evaluative criteria really changed the outcome of who was selected as Parent-Child Plus recipients. Another thing I'd like to highlight is once moving into the selection process, we had to do a lot here to shift the discourse from cost per family to what does an organization need to serve families. In Washington, and I imagine in many other states, we've relied for a very long time on an advocacy strategy rooted in the cost effectiveness of early childhood services. And that's important. That's really important. But what that also does is often if we rely on these ranges, that it can disadvantage organizations that may actually need more infrastructure, more capacity building, more staffing, and Pam will talk about this, a desk sometimes, in order to implement. And so we did a lot to change that conversation among the partnership between the city, United Way, and the county, so that we weren't saying, oh, that cost per family is too high. We were saying, what does that organization need to be able to implement this program to really reach their community? Pam, is there anything else you want to add to sort of flesh that piece out?
Yeah, we also, thank you, Melanie. We gave organizations a template to think about what their actual costs would be. We gave them a template to guide them on what their staffing should look like so they wouldn't undersell what their ability to implement the program. And so we gave them all of those tools to really flush out so they can ask fully what their needs were. Even though that didn't happen for everyone, culturally, people were afraid to put in, I think, a lot of true costs because they were afraid they wouldn't be selected. And they were used to underselling what their real needs were. And because a lot of these are extremely grassroots organizations who are always used to working on a shoestring, so they did not ask for a lot. and really having to coerce them to ask for what they really needed to operate fully.
Thank you. Yeah, and that ties into the next piece, which was our budgeting, and not our budgeting at the county level, but our sort of decision making around budgets and award allocations at the program level. So we made sure we were really thoughtful about not scoring budgets, and we didn't ask for a budget in advance. So once we selected programs based on the criteria that I talked about before. Pam went through a really thoughtful budget development process, sort of sharing what kinds of resources programs might need. And I don't think we nailed this the first time around.
No.
And
Not at all.
Yeah, Pam would agree.
It's the growth process. Yes.
Yeah. No, please go ahead.
No, and it's a growth process, because even in our effort to offer equity, there were still some inequities in what people asked for. And so we're, really trying to realign the budget template, giving people guidance about what are the things they can ask for, because sometimes you don't know you can ask for things and you won't ask for them. And you really get to see inequity even in the request of need. And so we had to really begin to sharpen how we lay out a budget template to these organizations so that we can get true costs.
Yeah, and in some circumstances, that meant literally, oops, I think we're getting some feedback. Are you? In some circumstances, for us, I mean, that literally means sometimes you're paying for half of an executive director. If you're, if it's a really small community-based organization, you want to make sure that particular community has access to services. That organization can't function. That program isn't going to function without the ED, and sometimes we're the only source of funding. And so we wanted to make sure that if that were the case, that we were actually covering it as much of those costs as we could. And again, we're getting better over time as we learn more. The next sort of body of work that we did, both in the initial selection process as well as in the subsequent renewal processes, was that we actually went through and adjusted caseloads. So while we had much higher caseloads from those programs that had been operating for a while, we coordinated across our sort of governing body to make a collective decision to reduce caseloads, which meant going back to council and saying these numbers are lower than we thought they were going to be, and things like that. And Pam, do you want to talk a little bit more about that caseload work?
Yes, when we were looking at what the ask for the home visitor, there were new assessments they were being asked to conduct. They were having to put in data in the data system, and we wanted to make sure that they weren't overburdened. So we began and we talked with National about what a full-time home visitor caseload should look like. And we went back and we told agencies for their full-time staff to reduce the caseload by 2 or 3, I think we said 11 to no more than 13. But not to, we encourage them not to let go of staff so that you can maintain your current caseload of staff and reduce the number of families you serve without reducing your budget. And that was a really extremely innovative where your funder is saying your budget will not be reduce your caseload to relieve burden of your staff. Like groundbreaking.
And you can move on to the next slide. Thank you so much. So the last piece here is just that we made a really significant investment in a range of capacity building supports. So Best Starts, in partnership with some of our other funder collaborative, we fund model specific technical assistance, that's Pam. We also provide ongoing data-focused capacity building. So this is capacity building really focused on issues like data entry, data quality, workflow, looking at your data for improvement, disaggregating your data. So we funded a whole body of consultants who work with our local communities providers to really strengthen their data capacity building. The next thing we did in our partnerships, so this was primarily through our work with the United Way of King County, they were able to secure private resources in order to support capacity building grants for our newly selected BIPOC-led organizations, which decisions for those capacity building grants were made through a completely participatory process. And the final piece that I will talk about here is just that in order to support the longevity and well-being of our early childhood practitioners, we have been providing free reflective consultation to all of our home-based services organizations.
So I'll just talk a little bit about the organizations that came on board for the expansion of Best Starts within the Parent Child Plus network. We had 7 new, very small agencies. You can see one of the things that we highlight is to really provide a cultural linguistic match. And I just wanted to talk about, as Melanie mentioned, in the funding approach, and one of the goals was the ability to build infrastructure and sustainability. So example, Congolese Internet Integration Network was a brand new organization, literally had no space, no office, or they were using or sharing a space, didn't have anywhere. Part of our programming is, to store materials. Well, they said, oh, we have a file cabinet. That's not enough to store materials. And so they had a lot of challenges. And so there was nothing but total support from BSK United Way in helping this organization grow. And so from this organization starting with us, with new space, to literally having a beautiful new office space where they're offering multiple services, that the initial investment from BSK to start Parent Child Plus, providing capacity building, has now allowed this organization to grow and to have multiple branches of service in which they've done. Another example of growth in one of our new, all these organizations have grown since their initial investments from BSK to implement Parent Child Plus. West African Community Council is an example of one of our agencies that, through their investments from BSK to implement Parent Child Plus, was able to apply for state funding for Parent Child Plus. And so then they actually grew, doubled in size of service delivery by being able to utilize and grow as an organization, utilizing these investments into an organization that probably would not have been funded if there was no BSK. And now has gotten to a place where they can invest or apply to a state entity and feel strong enough to deal with all of the requirements that come with state funding. And they are doing exceptionally well on both of their funding fronts. So these are just examples of these agencies. Each one has a story to tell, but we don't have time. And can we go to the next one? In 2020, we served over almost 1,300 children in King County. 48% were Black African American. The majority of them are African immigrants. As Melanie told you earlier, that we're 3rd in the country for Somali immigrants. The majority of the families that we serve in this population are Somali, but we do serve West Africans and African Americans in this group. This 25% of the population that we serve are Hispanic and Latin community. Most of them are from Mexico and Latin America, other parts of Latin America. And the 3rd greatest population that we serve are Asian families. Chinese, Vietnamese are the 2 largest subgroups within our Asian group, But as you can see by this grid, we serve a wide range of families. And if you go to the next slide, 50, our families speak, well, I'll just go to this one. Over 50 languages and dialects are spoken by our families. One of the things that we think is truly a hallmark of our program is that we work to provide a linguistic cultural match to every family that we serve. And the way that we're able to do that is that we hire from the community in which we're trying to serve. And so the beauty of the investment of VSK into organizations that are deeply rooted in community, who they are then able to hire staff from that same community. And it's a workforce development as well as just providing wonderful services where people understand the culture into the home they're going into, speak the language and dialect of the family that they're going into. And then the other piece that is beautiful about what is happening is that over 30%, around 30% of our workforce are former program participants. And 71%, as you can see here, of our Parent-Child Plus staff in Washington State speak 2 or more languages. And it's just a beautiful network of community in which we provide services in Washington State, in King County. And I'll turn it over to Sarah.
Hi, everybody. I just heard really the story that we want to tell about why looking at funding and programmatic funding through this equity lens is so critical for making sure that communities are able to hire the folks who can best do the work in their communities. So I'm just going to sort of flip it and take the perspective a little bit larger and talk about when you fund through an equity lens in King County or anywhere else in the country, what the really powerful things that it enables you to do are, one, to fund new and community-based organizations, not to fund the same old organizations again and again. And one of the things that we do see in communities that haven't had the ability yet to take this equity lens is that the public grants go to the same organizations, as Melanie noted, to white run, often 100-year-old social service agencies in communities. And you don't get the benefit of having your dollars work through community-based organizations that have deep knowledge of the families that you're trying to support with home visiting services, with childcare services. And this equity lens really enables you to bring a whole new perspective to the organizations that you're working with. The second thing is that you are more likely to end up with the homogeneous workforce if you don't have this equity lens through your funding supports. And we see that nationally in the national data just around home visiting, where 66% of the home visiting workforce is white. And that does not reflect the populations who are receiving home visiting services in communities. And with this equity lens to programmatic funding, what we see is this dramatically more diverse workforce that reflects the communities that we're working in and the families who we're working with in the community. And the last thing, and I think this is really important, and we both Melanie and Ngozi touched on it, which is this idea of really reframing the way we look at paying for the work. And that when we take this equity lens, we are able to start thinking about paying our early childhood workforce better, not just a living wage, but a thriving wage, and really having that those opportunities for advancement that look differently. As Pam noted, in King County, 30% of the workforce doing Parent-Child Plus are parents who completed the program as parents and have now been hired to work with other families in their communities. They don't have the educational criteria that we often use in public funding streams, that folks have to have certain degrees or certain credentials. You know, their credential is they've participated in their program. Their credential is they live in the community and speak the language and have a shared cultural background with the families that they are going to be working with. And this equity lens allows us to reframe this investment and prioritize hiring the folks we think have the best work and life experience to do this work, and to pay them the wages that that their work deserves. And so that's the sort of wrap up on why we think that the funding through this equity lens is so incredibly important. And I believe I am now handing it back to Simon.
Thanks, Sarah and Pam and Melanie. That was great. Really a lot, I think, that we can all reflect on for whichever part of the sector we're working in, really. You know, I think there's a lot of things there that really resonate in the childcare space, as well as the home visiting space and across the whole P-5 system. So that was great. Thank you. So we are right up at time. This was the end of webinar 5. All of the resources you can find on our website. We have one more webinar left on this series, which is March 31st. And we are developing that as a case study webinar where we wanted to dig a bit deeper into particular issues that are of interest to you. So we put together a super easy, quick 1-question survey, which Casey just dropped into the chat, and which we'll send out with the webinar slides and recording later this week, just to kind of give your input on what you want to see on that last webinar, what areas you want to go a bit deeper into, so that we can make sure we're planning something that is responsive to what you need. But with that, wrapping up right on time, which might be a record for us on these webinars. So thank you to all of our speakers. This has been a really great session, and have a good rest of your week, everyone.